Thank you, Karen, for the introduction. Indeed, ladies and gentlemen, dear colleagues, I'd like to address lifestyle issues in patients with congenital heart disease, and specifically also look at the outcomes of certain lifestyle choices. The title is Cigarettes, Alcohol, Diet and Exercise, so let's start with the cigarettes. So far, there are numerous studies that have looked at the proportion of patients with congenital heart disease who were smoking at that time. And this is a chronological order of all the studies that have been done so far. If we look at these studies and we calculate a median proportion of patients that are smoking, we found a proportion of 17.5% of the patients. But you see a wide variability in proportion of smoking, and you may wonder who are the ones with a high proportion and who are the ones with a low proportion of smoking. And you can imagine that vulnerable patient groups do have a low proportion, like this study, for instance, conducted in pregnant women with congenital heart disease, a study that was conducted in Belgium and the Netherlands. Another example are patients included with complex heart conditions, and this study was conducted in Sweden. So you may assume that the complex and the vulnerable groups are having a low proportion of smoking. Unfortunately, this is not the case. This study, conducted in the United States, found a pretty high proportion in patients with transposition of the great arteries and with univentricular heart. 6 out of these studies have compared the prevalence of smoking with that of the general population. And here we see that our patients, in fact, are doing better, a lower level of smoking. This is good news. However, there is also some bad news. And the bad news comes from this study, published earlier this year. This study looked at the proportion of smokers in a group of hospitalized and emergency department patients. And they looked at the trends from 2003 to 2012. And this is what they found. In 2003, 15 to 16% of the patients were smoking, respectively in the hospitalized and the ED patients. And this increased up to 28 and 21%. So this is really troublesome news. Especially if you know what the outcomes of smoking in patients with congenital heart disease can be. And of course, we all know what the general detrimental outcomes of smoking are, but we did not have a lot of information on specific outcomes for congenital heart disease. And this has changed over the past years. For instance, a study in 2014 conducted in people with right ventricular outflow tract conduits, they found a shorter freedom of conduit dysfunction in smoking patients. People with aortic valve disease that were smoking had an impaired patient-reported health. People with transposition of the great arteries and tetralogy of Fallot had an increased risk for unplanned readmission if they were smoking. And the wider spectrum, the wider population of adults with congenital heart disease had an increased risk for developing metabolic syndrome. The very first study looking at the impact of smoking in congenital heart disease already was published already in 2008, and that study showed that in people with transposition of the great arteries and tetralogy of Fallot, an increased mortality was found in those who were smoking, and even in a follow-up period of only 5 years. So you can imagine what the long-term consequences in these vulnerable patient groups are. What about alcohol? Well, it's pretty difficult to see what should attract our attention when we are talking about alcohol consumption. Because if you ask most patients, do you drink alcohol? Most of them will say, yes, once in a while I'm drinking alcohol. So that's not really a problem, I would say. But what is a problem is the proportion of binge drinking, and that's why I limited, for the sake of this presentation, I limited to binge drinking. A study conducted in Denmark found that 26% of patients with congenital heart disease were binge drinking, at least once a month. A study conducted in Canada found 44% of binge drinking, and a recent study conducted in South Korea found 47%. This is a pretty high number. This latter study, conducted in South Korea, also looked at the impact of binge drinking, and they found that hazardous and problematic drinking was indeed associated with an increased risk for developing metabolic syndrome. So far, this is the only study in congenital heart disease that looked at outcomes of alcohol consumption. What about diet? Indeed, there are several studies that looked at BMI and the distribution of BMI in the patient group. And when we look at the studies that indicated how many patients had a BMI between 25 and 30, being defined as overweight, it was found that 15 to 30% of the patients categorized in this group. Looking at those with a BMI higher than 30, the proportion ranged from 9% to 26.5%. And if you combine these two groups together, so being overweight or obese, the proportions range from 32 to 42%. And also here, the consequences are described. In people with right ventricle outflow tract conduits, a shorter freedom of conduit dysfunction was observed. In Fontan patients, it was related to symptomatic heart failure, mortality, transplant, or hospice referral. And in people with tetralogy of Fallot, it was associated with a higher New York Heart Association class. And then finally, let's focus on physical exercise, or rather the lack of physical exercise. So studies that looked at people with a sedentary life found that 38% to 68% of the patients admitted not to be physically active. And this is a problem. And especially, again, since the first studies came out on what the impact is of not being physically active, people with aortic valve disease who were physically active for 3 hours or more a week had a better self-reported health. So you can imagine that those with a sedentary life had a worse self-reported health compared with those who were active. And the wider group of adults with congenital heart disease, once again, had an increased risk for developing metabolic syndrome. So let's come to the conclusions. Detrimental health behaviors occur in adults with congenital heart disease. And even if some of the health behaviors occur less than in the general population, it's still troublesome. International variation is observed in the different health risk behaviors. However, we do not precisely know if this is due to real differences across the countries or if this is due to methodological differences. And therefore, we need international studies using a common methodology. The evidence on the impact of the health behaviors on outcomes is relatively new, but it's growing and there are still some blind spots. We need more information and more research on this. And indeed, in addition to the traditional negative influences of health risk behaviors, there is an indication that these behaviors suggest an additional burden above the structural heart defect. And that's the reason why health behavior interventions ought to be implemented in order to improve the overall health status of our patients. Thank you very much.